Welcome back. In today's Mental Health Check, July is Disability Pride Month, and today we're focusing on how the mental health crisis is impacting Americans with disabilities. About 40% of people with intellectual and developmental disabilities experience mental illness. That's according to the National Institutes of Health.
And on top of that, therapists, social workers, medical professionals, and law enforcement often lack the proper training when it comes to helping people who are dealing with some sort of disability or mental health issue. Joining us now is Leigh Anne McKingsley. She is the Director of Criminal Justice Initiatives at the ARC, an organization that supports people with intellectual and developmental disabilities. Leigh Anne, almost half of the people in this country with disabilities are suffering from some sort of mental illness as well. What are some of the factors contributing to this?
Well, we know that people with intellectual and developmental disabilities are likely to be stigmatized in our country. So even from adulthood or from childhood, they grow up experiencing different types of traumas, not only from bullying and other types of victimization, but we know that they're more likely to be victims of serious types of crimes. So when you take into consideration the stigma and the different types of victimization, this can really lead to serious mental health concerns throughout their life. And unfortunately, there's very little help that they can find. So we're looking for ways at the ARC to really address this problem head on.
Yeah, and Leigh Anne, of course, this is our mental health check-in, and it's no secret mental health care is kind of hard to come by for anyone, but how difficult is it to receive care if you're someone with a disability or you're just navigating that space?
It's very difficult. In fact, we know that there's little in terms of mental health professionals that have the kind of training and education that they need to be able to effectively serve people with intellectual and developmental disabilities. So there's a big issue with that. And the second issue is that there's a lack of coordination among the systems that serve these individuals. So you've got the mental health system, and then you've got the intellectual and developmental disability system. And often those two don't talk. And that leaves families and people with disabilities just kind of stuck in the middle with no help at all.
Leigh Anne, that first thing you mentioned of there not being enough people with the proper qualifications to help, what's being done in spaces to help bridge that gap so there is more funding for people to be qualified and trained to help?
Well, we're looking at trying to develop policy, first of all, that can affect systems of change. So the more that we can push for policies that kind of integrate these systems, the better off that people with disabilities will be. But we're also looking to expand we're looking to expand training for healthcare professionals. So often they do not get the training that they need around these issues. We've got a project right now called Talk About Sexual Violence that's looking to train healthcare providers, from doctors to nurses, about how to talk to their patients with intellectual disabilities about sexual violence.
So briefly, what can viewers do to foster a more inclusive healthcare system?
Well, what we're hoping individuals will do is when they go to their doctor's offices, they can bring this message to them to really start to think about their own biases. We all have biases, but we need to be aware of that because it's really impacting how effective we can serve people with disabilities. Educating themselves about disability rights and then just being consciously aware of that is going to make a big difference
there's
in
so
their
much.
lives.
There's so much people can do. Leigh Anne McKingsley, thank you so much, and thanks for watching NBC News Daily.